So I've been using shockwave therapy for 10 years. I started doing that after a shockwave therapy congress, and that behooved me to learn diagnostic ultrasonography. And today I don't do any shockwave therapy without looking at where I'm doing, what I'm doing. So it sort of became ultrasound guided shockwave therapy. So if pathology is very simple, you might not need guided shockwave therapy, but most pathologies is not that simple, and knowing ultrasound and guiding it really makes results totally different. In fact, there are many papers published about it. So we have Brian here as one of our patients, and he was okay for us filming him, and he is a unique case. He has very rare disease. It's interarticular calcification in his elbow, and he has pain difficulty bending that elbow, and the only suggestion that the orthopedics were suggesting was surgery, and this is very extensive surgery because he has calcifications medially, laterally, posteriorly, so it would be very extensive surgery with lots of complications. So we've done 2 sessions already, and how do you feel? Do you have any results so far?
Yeah, feels a little better.
Feels a little better. Would you say 20, 30%?
I think 30%.
30%. So I didn't expect such fast results because shockwave therapy brings result, but not necessarily right away. In this case, I was surprised myself how fast the results are. So let me show you what we see in here on ultrasound. So this is the joint line medially. This is his medial condyle, and this is the joint line, and you see how the bony surfaces are really protruding. And if I go posteriorly, if I bend his elbow and I go posteriorly, I could show you a lot more of these calcifications. Here's my mouse, and you could see a lot of calcification all around the joint. In particular, pieces like this will disallow this joint to bend because they literally obstruct the joint. And if we go laterally, actually he felt that the most improvement was on these lateral epicondyle, this particular large bony protuberance. And all of these things not only, and here's actually much better view of these calcifications right here. So he's got calcifications all over his elbow. He's feeling better, so we still have 3 more to go, and hopefully he would avoid surgery. So I've been doing shockwave therapy for 10 years. I've been doing diagnostic ultrasonography for 10 years. It's a fantastic combination. We get people better with any kind of tendon issues, some muscle issues, trigger points, and even hard cases like fractures, partial fractures, non-ossified healings, all kinds of calcific tendinopathy calcifications. Shockwave therapy has literally been revelation in the treatment of musculoskeletal disease, and I've been doing it for 10 years together with diagnostic ultrasound, and I've seen over 3,000 cases with great results. So why exactly you need guided shockwave therapy? Because patient presents with a pain complaint, and we know that pain is not always where the problem is. So if you focus your shockwave on the pain, it may not be where the problem is. In the example with Brian, this is exactly the case, that the pain is a little bit above and below the elbow, but I have to go on the ultrasound and really focus on where those pieces of the calcium that impede joint movement is, and not go by pain.